Have you ever met someone who seems incredibly energetic and unstoppable one week, and then suddenly disappears into silence the next? What if I told you that this dramatic shift is not about moodiness, not about overreacting, and definitely not a personality flaw, but one of the most misunderstood psychological conditions in the world? Today we're diving deep into the real psychology behind bipolar disorder, how it works, why it happens, what it feels like, and the surprising science most people have never heard. What bipolar disorder actually is? Bipolar disorder is not just mood swings. Everyone experiences fluctuations in emotions, but bipolar disorder involves extreme, clinically significant shifts in mood, energy levels, activity and productivity, sleep patterns, thinking speed, decision-making. These shifts are not small changes. They are so intense and long-lasting that they disrupt daily functioning. The disorder is defined by two major states. 1. Mania or hypomania, an elevated, overly active or irritable state. 2. Depression, a deeply low, exhausted, hopeless state. People with bipolar disorder cycle between these states, though not always in predictable patterns. Types of bipolar disorder. There are three major types, and they vary in severity. 1. Bipolar I disorder, defined by full manic episodes lasting at least 7 days. Depression episodes often occur but aren't required for diagnosis. Manic episodes may become severe enough to require hospitalization. 2. Bipolar II disorder, defined by hypomanic episodes, less intense than full mania. Major depressive episodes are essential for diagnosis, often misdiagnosed as depression because hypomania can be overlooked. 3. Cyclothymic disorder, chronic, fluctuating mood disturbances, periods of hypomanic symptoms and depressive symptoms, lasts at least 2 years in adults. Each type changes how symptoms show up, but all involve unstable and cyclical patterns of mood and energy. What mania actually feels like. Most people imagine mania as simply being happy. But the psychology of mania is far more complex. Common features of mania: a sudden surge of energy and confidence, feeling invincible or unstoppable, talking very quickly or jumping between thoughts, sleeping far less than usual yet feeling rested, impulsive decision-making, increased risk-taking behavior, irritability that can escalate into anger. Inside the mind during mania, thoughts can feel like a racing engine with no brakes. What causes bipolar disorder? Scientists don't know one single cause, but they do know bipolar disorder is a combination of 1. Genetics. If a close family member has bipolar disorder, your risk increases significantly. 2. Brain chemistry. Research shows irregularities in neurotransmitters like dopamine, serotonin, norepinephrine. These chemicals regulate mood and energy, and dysregulation can lead to mood cycling. 3. Brain structure differences. Imaging studies show differences in prefrontal cortex activity, amygdala reactivity, connectivity in emotion regulation networks. 4. Environmental triggers, chronic stress, trauma, irregular sleep patterns, substance use, major life changes. These factors don't cause bipolar disorder alone, but they can activate symptoms in someone who is genetically vulnerable. How bipolar disorder is diagnosed. Diagnosis involves a psychological evaluation, clinical interviews, pattern analysis of mood cycles, ruling out physical causes like thyroid disorders. Because bipolar disorder overlaps with depression, ADHD, and personality disorders, it is often misdiagnosed, especially bipolar II. The key diagnostic feature is manic or hypomanic episodes. These episodes differentiate bipolar disorder from major depressive disorder. Treatment and management. Bipolar disorder is highly treatable with the right combination of approaches: medication, mood stabilizers, lithium, anticonvulsants, atypical antipsychotics. These help regulate mood cycles and prevent extreme episodes. Psychotherapy, cognitive behavioral therapy, CBT, helps with thought patterns. Psychoeducation improves understanding and management. Family-focused therapy strengthens support systems. lifestyle management, regular sleep schedule, stress reduction, avoiding substance use, tracking mood cycles. Bipolar disorder is a lifelong condition, but with consistent treatment, many people achieve long periods of stability. Behind every manic episode and every depressive crash is a human being navigating the complexity of their own mind. Bipolar disorder does not define a person. Many individuals with bipolar disorder are creative, insightful, resilient, and capable of extraordinary achievements. Thanks for watching, and remember, the mind is complex, but understanding it doesn't have to be.